Hello there. Welcome to another installment of the Brains versus Stomachs project. On this episode in our research channel, we will be talking about the main model we use for our work and our project. We use the neoclassical framework, more specifically endogenous growth theory, to explain how the demographic transition affects macroeconomic growth and productivity, hence the term demographic endogenous growth theory. Neoclassical economics meets demography. So what exactly do we mean by DEGT? Simple definition and why we use this approach. Effectively, demographic endogenous growth theory attempts a neoclassical synthesis of the effect of demography on the economy that recognizes adult labor as the primary factor of production for other inputs. Effectively, contrary to the exogenous model, which says technology, capital, and population growth are exogenous, in reality, these items all require the adult labor time of economic agents. It goes back to an economic axiom that labor is the primordial factor of production. So, we have four factors of production: land, labor, entrepreneurship, and capital. They boil down to two, basically: natural resources and labor. And labor is the one that's in short supply and the one that you need for production in any economic activity, really. It's the active factor of production. And so what we seek to do is to substantiate our thesis that the demographic transition necessarily increases the ratio of labor per capita, which then has an expansionary effect on macroeconomic growth and productivity. So let's talk a little bit more about our deviation from the main models most people are used to when we talk about demography and the neoclassical framework. So we'll do this. We will illustrate this using the neoclassical Solow Swan model. So output Y is a function of physical capital, human capital, technology, and labor, together with your various output elasticities. So the macroeconomic model assumes that physical capital, human capital, and technology are exogenous to labor. They are not, and here's why. Physical capital, the production of things like office buildings, roads, and other such infrastructure, requires workers allocated to that production cycle. So you need engineers, plumbers, welders, architects, electricians, and the like. The same applies to human capital, right, which effectively estimates the efficacy of the economic agent in production, how endowed they are with various factors at a human level. So that requires educators, right, teachers, lecturers, librarians, and very importantly, it requires carers and parents, typically excluded in our neoclassical framework. And this dovetails nicely with the work of Nancy Folbury and the feminist economics field writ large, which recognizes or highlights the importance of carers and parents, and specifically women, in the development of human capital, a factor that's typically not included in most neoclassical models, and we attempt to fix that here in our model. Moving on to technology. Technology requires innovators, scientists, researchers, inventors, designers, and the like. So effectively, labor time is the primordial factor of production for all the macro sectors, right? Capital, human capital, and technology are actually endogenous to labor when you think of the actual production cycle. And this would explain why the Solow Swan model typically comes with quite a bit of multicollinearity, because essentially as you get more workers per capita, more of them can be allocated towards physical, human capital, and technology. It also explains the omitted variable bias that we get with the Solow model, because effectively you're omitting the labor time allocated to these factors. It also broadly explains why we don't see the convergence our theory tells us we'll see when we look at the Solow model and compare it to real-world data, which the model tells us there'll be convergence as poorer countries catch up. Well, if you have variations in workers per capita, you will have variations in capital, human capital, and technology per capita, and hence you will actually get divergence. So we call this the macroeconomics exogeneity error, right? Effectively failing to recognize that physical capital, human capital, and technology are functions of labor. And in our approach, using the endogenous models, we attempt to correct for this, and hence show you how the neoclassical model, once one accounts for this anomalous interpretation, this error, you actually get a neoclassical model that better explains macroeconomic growth and productivity. So let's get to the core of the synthesis. We will do so using a Mankiw-Romer wheel variant of the Solow Swan model, which we illustrated earlier. Let's begin with our whiteboard here. So we will be going through this using an endogenized four-sector Solow Swan model with human capital as follows. So we'll start with our basic production function as before. You'll notice one little variation here, which is that we simply split L into N, total population, multiplied by L over N, workers per capita. So we'll start with our laws of motion, and we will be using the exogenous model for this one just for illustration before we shift to an endogenous interpretation. So in your typical Solow Swan model, you say the growth rate of capital, or rather the growth in capital, physical capital, is a function of the savings rate of capital and multiplied by the output minus your depreciation factor. Human capital is a function of your savings rate for human capital multiplied by output and minus your depreciation factor. And typically the Solow Swan model, the exogenous version, assumes that technology growth is exogenous and that population growth is also exogenous. So these are our four sectors: physical capital, human capital, technology, and population. So the first thing we want to do is expose a few demographic variables and insert them into our production function, thusly. And we get this little insight from the dividend hypothesis. It's a straightforward split that workers per capita is a function of adults per capita, that's uppercase lambda over total population, multiplied by labors per adult. So we'll just start with adults per capita. That is a straight demographic function determined by your birth rates, death rates, and migration. So lambda for the birth rate, mu for the death rate, and the Greek letter nu for the migration rate. Those three demographic factors explain our ratio of adults per capita. Moving on to our second variable of workers per adult, we instantiate two variables here, upsilon and phi, the Greek letters. Let upsilon equal the urbanization rate, which takes on values between 0 and 1. Effectively, this is an inclusivity factor, right? Of the adult population, how many of them can we, or rather, how much labor can we extract from the adult population? We're using a modern interpretation of labor where we are more interested in specialized labor, and hence why we have the urbanization rate. And then we also have the labor force participation rate, right? Out of those urbanized adults, how many of them are male workers? How many of them are female workers? Effectively, you've got your male labor force participation rate together with your female participation rate, and that's the Greek letter phi. So upsilon phi gives us the ratio of workers per adult. Now, substituting these into our production function, we get the following equation as before, except now we'll highlight our first four sectors here: physical capital, human capital, technology, and population. But now workers per capita now gives us the demographic variables that we want to expose. That is the fertility rate, mortality rate, migration, urbanization, and labor force participation rate. So, again, going back to our core thesis, how does this affect the production and, the importance of having to endogenize? So now we'll restate our laws of motion, factoring in the endogenization, right? The necessity of endogenization. We'll start with capital. So capital, of course, is a function of labor time allocated to capital LK, multiplied by theta K, which is simply the productivity factor. So let theta equal the various capital, human capital, and technology required to improve productivity of capital. So, just to give you an example, so let's say an engineer a builder is building a building, right? Construction workers say. So capital in this instance would be the various tools like, various drills and the like to, assemble the unit. And then human capital would be, for example, their education, right? Their learnings about how to operate these various items. And then technology would, obviously be the technological components that they're using to, build the building. So theta K is the productivity factor. Effectively, what's happening is that savings, you save the money, right? The economy saves funds, but those funds are then channeled into laborers who then produce the actual capital. And of course, we add our depreciation function. We get the same for the growth in human capital, right? A function of labor allocated to human capital, and the various productivity factors, and of course your depreciation factor. Now we get to technology, and here we get our insight from the work of Paul Romer and his work, technology and endogenous growth, effectively labor hours allocated to producing technology multiplied by the the productivity factor. So this theta LA is something you will have picked up from the technology paper that Romer won his Nobel Prize for. So we get that little insight from there. And in all cases, again, we're endogenizing, right? All these factors are now, all these functions rather, are now factors of labor time allocated to the respective macro sector. Finally, we get to a big one here, which is population. Again, harking back to the feminist economics contributions, typically population growth is assumed exogenous. Of course, it isn't. The storks don't make babies, humans make babies, and so in order for the population to appear, you need labor time allocated to population, that's Ln. The various productivity tools, and this is where the work of Nancy Folbury comes in, because theta n is effectively the household and the various assets and tools required to essentially grow a human being from being a toddler to being a functional adult. In addition to that, however, you also factor in your fertility rates, mortality rates, and migration rates, represented here as, with an asterisk, just to point out that, it's not exactly the same as the ones we defined here. And here X, for just to mention, X stands for the age. So we're looking at fertility as a function of age, mortality as a function of age, and migration as a function of age. So we now have a production function together with various endogenized laws of motion that better explain how these assets, resources are produced using labor, and recognizing that axiom that labor is the primordial factor of production. Hence, we get this endogenization formula here, that the total stock of labor at time t equals the stock of labor allocated to capital, capital production, physical production, physical capital, and the labor allocated to human capital, labor allocated to technology, labor allocated to population, and labor allocated to producing the final product. And so this endogenization equation again hammers home the central point that labor is the primordial factor of production. All these factors effectively rely on the stock of labor in order for them to grow. And so let's now move on and to investigate how exactly this works. But before we do so, we can just rewrite our output, our production function in terms of labor time, right? Again, capital, physical capital, human capital don't just appear. They are functions of labor time, labor hours allocated to the various sectors. And so we can think, in terms of full endogenization, we can think of the production function as output being a function of labor time allocated to physical capital, labor time allocated to human capital, and labor time allocated to technology and population, together with the various elasticity variables there. Now, of course, in this grayed out formula here, we are, of course, assuming, full-on endogenization, right? In reality, you'll probably have, endogenization with exogenous factors, or an exogenous model with endogenous, effects, right? But again, we're just simplifying it here, pointing out that labor is required for the production of all these items. Right, so let's go back to our core thesis. How does the demographic transition impact output, right? More specifically, how does a reduction in fertility rates and a moderation in mortality rates affect economic output? So we'll just plot that as the result, a little placeholder. And let's just recap on our endogenized four-sector Solow Swan model in terms of on a per capita basis. Output per capita function of, physical capital per capita, human capital per capita, technology, and our various demographic variables that we've now inserted into our production function. And we should also just recap that, total labor is a function of labor allocated to the various sectors, but we've also added E here just to represent, labor that is not allocated to these factors, and that'll be important later on. So let's start with investigating the effect of mortality on economic output and production. Effectively, a moderation in the mortality rate leads to an increase in adults per capita, right? You're effectively increasing the survival rate of economic agents. Prior to the modern day, health regime we have now, over 50% of all humans, of all economic agents would expire before their 5th birthday, and so you had a fairly high hazard rate, if you will. And when you moderate those infant mortality rates effectively over time, you're getting more adults per capita. And again, we can just look at the production function, which we stated here. That necessarily leads to an increase in labor hours per capita and hence output per capita. This mortality effect is effectively human physiology, right? Adults are naturally more productive than children, and hence the more adults per capita you have, ceteris paribus, the more goods and services one can produce over time. So that's the mortality effect. Let's now look at the participation effect, right? And that comes from a moderation in fertility rates, right? So as fertility rates moderate and decline, you necessarily, well, it's perhaps also a function of policies to do with gender equality, but effectively, the less time women are spending, having lots of children and taking care of them, the more time they can now allocate to labor, including time allocated to educating the existing children. Remember, in our neoclassical framework, we don't recognize the human capital sector of people taking care of children in their home. Now we do. And so, again, the less time is spent on fertility, the more time that can be spent with women participating in the labor force. And again, that increases our ratio of labor hours per capita, while also increasing the ratio of output per capita. Again, a straight effect from our production function. So these two factors here, mortality and gender equality, are very, very important. Again, it goes back to the numbers. Before the demographic transition, 50%, well, over 50% of all children never made it past their 5th birthday, and women representing 50% of the human population were typically excluded from the formal economy. And so these two factors combined, it basically represent a significant exit rate from the formal labor force. Effectively, in the absence of a mortality transition and a fertility transition, you effectively have an economy where it's just a few men who are, survived high mortality, taking care of things, while women and lots of children are effectively dependents. And so that's why the demographic transition has a profound effect on economic output and productivity, right? Effectively, you're doubling your labor force when you include women, and you're also doubling your labor force when over half your children can now, when basically almost 100% of your children can now make it into adult years as opposed to 50%. There's another important effect here, which is urbanization, which we touched on earlier, which we get from the classic scholar, the grandfather of economics, if you will, Ibn Khaldun, and that is the importance of urbanization, more specifically specialization on output per capita. Again, it goes back to labor allocation. The higher your specialization rate, the more labor hours you can allocate towards capital, technology, and population, right? Specialization. In this instance, what we're really interested in is specialized labor. Of course, we use urbanization as a estimator, if you will. Effectively, the more people that are not included in the specialized labor force, right? They are effectively subsistence farmers or people who are not in the labor force, hence the term LE here, right? Effectively, potential labor hours that are not being allocated to production. And hence, the higher the urbanization rate, the more specialized labor hours per capita one can extract, and hence the more output per capita one can get. Again, that comes from our variable we instantiated here, upsilon, which again goes back to our production function here. And of course, just worth mentioning, of course, what we mean by LE here is effectively this isn't really part of specialized labor. It's effectively hence why I said I'm being a little bit cheeky here, it's effectively the potential workers who are excluded from the specialized labor pool. So, a demographic transition, which is a moderation of your fertility rates, a moderation of your mortality rates, and an increase in the urbanization rate, necessarily lead to an increase in work hours per capita and an increase in output per capita. But there's more. There is also a growth effect. And on this one, we draw on the work of the Cole-Hoover theory in 1958, which states as follows. The lower your growth rate of the population, right, it's a time switch effectively, the less time you're now spending taking care of children and raising them, the more hours per capita you can now allocate towards formal production. And here, this is an important effect, right? The higher your aggregate propensity to save. And so effectively, the more you can now save, the more hours you can now allocate to physical capital, human capital, and technology, and hence the faster the rate of growth. So that's the growth effect. Effectively, as you get, if I can just work through an example here, imagine you go to a village and there are only 5 workers for every 100 people. And let's just say the total population is 100. Realistically speaking, all 5 of them have to basically focus their efforts on producing for consumption, right? So that is LY, right? And LE, subsistence farmers. You don't really have time that you can allocate towards, say, building a new fence or developing new tools, right? All time has to be allocated to meet consumption. That's, a high marginal propensity to consume. But let's say you go through a demographic transition, and instead of having 5 adult workers for every 100 people, you now have 30 or 40 workers for every 100 people. Well, now the good stuff can happen because some of them can be allocated towards education, right? Some of them can now allocate their time towards building better tools. Some of them can allocate their time towards improving the existing equipment or building new equipment, new technology, and hence you will have a faster rate of growth as more labor hours are allocated to physical, human capital, and technology. And hence, this is the second effect. The higher ratio of labor hours per capita, the higher your output, and the higher the growth rate of output per capita. So that's, in summary, the effect of the demographic transition on economic output and productivity when we factor in endogeneity. We can also derive the same results, rather this result here can also be derived through brutal quantitative induction. If one can prove the following differential equations, effectively you get the same output here. If you prefer that approach, the derivation of these results is fairly tedious and trivial, and hence left as an operation for you, the dear user. But effectively, a little bit trickier might be, solving the differential equations for infant mortality and fertility. But, you can get there. So that's the theory. Now let's look at the evidence. So on our y-axis in our favorite chart here, we have GDP per capita, real GDP per capita adjusted for price levels. And on the x-axis, we have median age. Now, we're using median age as an estimator for L over N. Of course, it's not a perfect estimator, right? It's a good estimator for adults per capita, right? Uppercase lambda over N. But we are committing an omitted variable bias here by not including the inclusivity effect of labor hours per adult. But effectively, we're trying to get to what happens as L over N increases, in terms of GDP, and it's exactly as per our thesis here. The more adults per capita and the more workers per capita a population can generate, the richer they become. And although it's not easy to see here, the faster they grow. Effectively, when nations are young, right, pre-transition, you're talking median age of 20 and below, that higher marginal propensity to consume means that the few workers available in the industry or the sectors can only allocate their time towards producing for consumption, and so you get very little growth, and economic output is low. But post-transition, you now get more workers per capita who can now allocate their time towards producing the more productivity-enhancing resources such as human capital, physical capital, and technology. And of course, this is data going back to 1950. We get this from the Penworld table in terms of GDP per capita and the UN in terms of median age. And we can see a very consistent result that the demographic transition really is a causal force that has an expansionary effect on growth and productivity. So let's just summarize exactly what the transition is doing to economic growth and productivity in this chart here. Same one as before. Effectively, if we can just talk at a high level, the demographic transition alters the realm of possibilities, right? We get this little nugget from the man himself, this young man right here, Dr. Nicholas Eberstadt, who defines the demographic transition, I'm paraphrasing here, as a social force that alters the realm of the possible, right? Effectively, when nations are young, the realm of possibilities is constrained. You're either, low income or very low income. And post-transition, median age of 40 and above, you're now at the low end, you're middle income, and at the high end, you're, upper or high income rather. So in stage one, and you're talking median age of less than 20, output is very low, bearing in mind that, the demographic transition moves one way. An economy that's young today has been young in the past, and so it's been growing very slowly in the past, and it's already producing very little, hence why output will be very low, and growth rates will also be very low. You move to a stage 2 pyramid, and, nice things things slightly improve. You're talking median age of 20 to 25, and you can see here most countries are still in that sort of low output field, but the growth rate and output rate now, not as bad. The magic really happens when you get to stage 3 and stage 4, talking median age from 25 to 40. Your output is now more moderate, and your growth rate is moderate to high. Right now you're cruising. Right now you have enough workers per capita such that you no longer need to allocate that many towards taking care of consumption. More can now be allocated towards growing things like, again, your physical capital, human capital, and technology. And then finally you get to stage 5, right, where you now experience a moderation in growth rates, right? And so the growth rate now goes from being moderate to low, but not that low, right? Countries can still grow, and output is now high because these are nations that have now enjoyed the benefit of higher growth throughout their stage 3 and stage 4 demographic pyramids. And so that's the effect of the demographic transition. Effectively, it's also an economic transition that alters the realm of the possible. So let's just recap about what we've talked about here. So effectively what we've done is we've used the same Solow Swan model, but endogenized it. Effectively, it's kind of like a Lucas Uzawa model, or if you want to think of it as an endogenous model. And again, it goes back to our economic axiom here that labor is the primordial factor of production. That's something we've now corrected for. And we've also integrated our demographic variables, that is fertility, mortality, and migration, as well as the inclusivity factors of labor force participation rate and urbanization. We've now identified the causal channels, and we'll talk about this later. Effectively, gender equality, inclusivity, and healthcare are the socioeconomic instruments, right? Through gender equality, you moderate your fertility rates and increase the labor force participation of women primarily. And through investments in healthcare, you moderate your infant mortality rate, hence increasing the ratio of adults per capita and hence output per capita, and also growth rate over time. Now, the key one here is time, right? That's been really, endogenization is also key, but time is an important concept here, right? We've talked about how one should think in terms of labor time and not necessarily labor force, because that is the real primordial factor of production here, labor time, right? That is what the demographic transition is endowing the population with, right? It's endowing the economy with more aggregate labor time per capita that can then be better allocated towards various resources. So these are the four modifications we've made, and sort of the improvements. We now have a neoclassical framework that better explains economic growth and productivity once we correct for the exogeneity error. Part 3, let's talk a little bit more now about the socio-economic policy prescription, right? The instruments, if you will. So, we'll talk about the first factor, which is fertility. We can now say that low fertility effectively has an expansionary effect on economic growth and productivity, right? Effectively, it's a time switch, right? You're allocating less time towards reproduction and instead allocating more time towards the production of goods and services, as well as the productivity enhancing resources for that production. And the instrument here is reproductive rights, right? The importance of, I mean, of course, it's more than just reproductive rights, but that's the major one, right? That ensuring that women and families writ large are in control of their bodies and having the children they want, and thanks to lower mortality as well, they can now have fewer children, which, like we said, now has an expansionary effect, direct expansionary effect on growth and productivity. The second factor is female labor participation, right? And we're also including the variable here, inclusivity. Effectively, the Greek, the variables we identified as phi. Effectively, gender equality and social equality allows you to harness more labor hours per adults, right? Women represent half the population, so having them work versus, being locked away in sort of domestic servitude is good for the economy, right? You can now get more labor hours per capita. But another important factor is social equality, right? So you also want to minimize the exclusion and outright remove the exclusion of certain groups of people on the basis of things like people's sexuality, their race, their ethnicity and the like, religion, right? You want as many of your adults per capita engaged in formal economic production. So going back to that village example, if you have a village, say 5 people are only working out of 100, and the villagers tell you, well, we don't allow women to work, and we don't allow certain, people who come from a certain religion to work, and we don't allow, certain ethnic minorities to work, and it turns out that, those women, those ethnic minorities, and those religious minorities, say, are 15, well, that's a contractionary effect, because you're now relying on 5 people to produce for 100, when you could have 20 people producing for 100, right? And so egalitarianism writ large has an expansionary effect on macroeconomic growth and productivity. We've talked about urbanization, but the quirk here is that the instrument is universal nutrition. Now, why is that? You might think urbanization is about building, roads and apartment buildings and electricity and piped water, and that's important. But let's say you go to a village and everyone is living in their ramshackle buildings, and you build you say, okay, we're moving you to the city where you'll have an apartment to yourself. Well, unless those people have food, they can't really allocate their time towards specialized labor, right? They need nutrients in their body before they can allocate their daily 8 hours towards producing, to engage in specialized production, right? If they go to the city and there's no food, well, they'll just move back to the rural areas and spend their time, working the fields so they can feed themselves. So the key to urbanization is actually universal nutrition, making sure that all your economic agents have the right complement of nutrients in their bodies that allows them to then expend their energy towards specialized output, which again has an expansionary effect on economic growth and productivity. And then we get to health, right? And the instrument here is universal health care. And this, of course, is, fairly well covered. I won't go too much into it. the work of, Dr. David Weil and many other scholars in that field, very robust, that healthcare, rather improved health outcomes do indeed have an expansionary effect on economic growth and productivity. And again, it's just a time allocation, right? Instead of economic agents spending their time 7 feet under the ground, they're now spending their time alive and producing goods and services, right? That's what healthcare does. But also, lower your disability rates, right? So effectively, as an algorithm, if you will, what you're trying to do is increase your HALE, right? Your healthy age life expectancy, while also, minimizing your DALE, right? Your disability years. And effectively, that gives you more labor hours per capita, and hence, health has an expansionary effect on growth and productivity. Finally, we get to migration, a little bit of a hot button issue. But effectively, the instrument here is economic migration and inward migration, right? We're only interested in economic migration. Let's make that clear. We're not talking about migration in terms of, asylum seekers or students or the like, just economic migration, right? The migration of workers. Effectively, inward migration has an expansionary effect on the receiving nation, right? They're getting more labor hours per capita. Whereas outward migration has a contractionary effect on the economy of the sending nation, because they are losing labor hours per capita. And that highlights the effect of the brain drain as well, which we will talk about later on. But effectively, migration has a small effect on these things. And of course, it's important to highlight that migration is not that big a factor compared to healthcare, gender equality, and inclusivity. Hence why we mostly bias our time and effort towards those factors and not so much migration. Part 4, Applied Demographic Endogenous Growth Theory. Let's now look at a case study and show you how these demographic factors can explain differences in certain economic outcomes. In this specific instance, we're looking at healthcare outcomes between Nigeria and the USA. So let's start with the high level. The US is, better health outcomes than Nigeria. They have a much higher life expectancy, a higher HALE, lower infant mortality, much lower infant mortality, lower neonatal mortality, that's below 1 year, and lower dailies per 100,000. And this is data for 2021 to 2021 to 2022, and the source here is the World Health Organization and IHME. So, fairly obvious to most that yes, the U.S. being a developed country has better healthcare outcomes than Nigeria. But now we can look at our demographic factors to explain these variations, because when we look at the ratio of healthcare labor hours per capita, we see strong variation. So the USA, for example, has 10 times the number of doctors per capita as Nigeria. They have 8 times the number of nurses per capita than Nigeria, 26 times the number of dentists per capita, and 13 times the number of pharmacists per capita, et cetera, right? We can add surgeons and lab technicians and all that great stuff. But effectively, the United States has more labor hours per capita allocated to healthcare provision than Nigeria. And so that is the main causal factor explaining differences in healthcare outcomes. Effectively, if you're beset with disease and you're in the middle of Nigeria, you will struggle to find adequate health services. Not because the government is failing much, but rather just a raw demographic effect, right? There are few healthcare workers per capita able to attend to your illness or your injury. Whereas in the United States, there is well, perhaps maybe not an abundance, but certainly a higher, much higher availability of those healthcare workers. And hence, an injured or sick person in the US can receive better care than one in Nigeria. And we want to highlight here the effect of migration, right? Because of migration, effectively, the U.S. Has 8 times the number of nurses per capita. But once you remove from migration, because the USA receives nurses, whereas Nigeria loses nurses, that ratio goes from 8 to 5, right? And so that highlights the effect of the brain drain. Effectively, through the brain drain, Nigeria has worse healthcare labor hours available per capita, while nations like the US have more healthcare labor hours per capita, and hence why the brain drain has a divergence effect on economies, as nations that are losing their workers are effectively now less able to provide, the relevant goods and services for their population. So, in summary, the USA's superior health outcomes are primarily a result of better healthcare worker hours per capita, right? And associated factors, because it's not just doctors and nurses, it's also sanitation and infrastructure. And again, we can go into that field as well. You will find that America has more, cement manufacturers per capita, more bitumen suppliers per capita, more engineers per capita, more builders per capita, and hence why, across a range of outcomes, America does well than Nigeria. And it's important to notice as well that there is a vintage effect, right? America has had more labor hours per capita in the past as well as today. And so that vintage effect is also important. And this contrasts greatly with the sort of mainstream explanations for these variations, which is that it's institutions, governance, corruption, politics, et cetera, capitalism, free markets, so on and so forth. In reality, it's just differences in available labor hours per capita, right? It's just demography. And the good news is that through an accelerated demographic transition, Nigeria and developing countries writ large, who are mostly young, can catch up through the instruments of gender equality, inclusivity, healthcare, universal nutrition, migration reform, and then education. Now, I mention and then education not to sort of deprioritize education, but rather just to highlight that in order for you to get more education, you need more educators per capita, right? And in order for you to get those labor hours per capita, you first need that gender equality, inclusivity, healthcare, nutrition, and migration reform. So education is important. But in the absence of labor hours in education, you can't really improve educational outcomes. Nonetheless, education is very important because, of course, it's through education of young girls especially that you can then accelerate the demographic transition, because educated girls are, they now have a much higher opportunity cost of fertility, and hence they choose to work and have fewer children. But it also liberates women from having to, well, especially young girls, from having to marry young and be locked away, in domestic servitude, as we mentioned earlier. So education is very powerful. And what I also hope you get from this analysis is the importance of women's and girls' education specifically, right? The more educated girls are, the lower the fertility rate, the more labor hours per capita one can get. So, very, very powerful effect. So this updates our convergence hypothesis. Remember, in the classic exogenous neoclassical framework, we don't really have a good explanation as to why convergence isn't happening. Well, through endogenization, we now have a much better explanation for why we're not seeing the convergence we would hope for. Because effectively, in order for you to have convergence in aggregate economic output per capita, you must have, to a certain degree, convergence in aggregate labor hours per capita, right? And so that's where much of the divergence we observe in the world, past, present, and future, can be explained by these demographic variations. Part 5, the conclusion: demography matters. So we'll try to end it perhaps with an analogy of sorts, right? The demographic transition is not destiny. That's not the argument we're here to make. However, it is a crucial component for economic growth. Think of demography as cheese and pizza, right? Demographic transition is to the economy what cheese is to pizza. Effectively, you can't make pizza without cheese. Well, you can try, but that's an abomination. In order for you to have good pizza, however, it's more than just the cheese, right? It's the flavor, it's the toppings, it's the aroma, it's the presentation, it's all these things, right? So you can't make pizza without the cheese, but good pizza is more than just cheese. It's the same with the demographic transition and development. You simply cannot develop without a demographic transition. But development, right, prosperity especially, is more than just a demographic transition, right? That's when the other factors kick in, like institutions and do you have free markets? Do you have competitive markets as well? And do you have rule of law? Do you have peace, right? Do you have good governance and all that wonderful stuff? But first, you must get a demographic transition. And of course, this is broadly consistent with the unified growth theory that comes from Dr. Oded Galor and David Weil, right? They synthesize the same. So we're not here to say anything new. Rather, we're simply here to articulate this already existing argument through the neoclassical framework once we correctly use an endogenous model versus the usual exogenous models. We'll close off with a cringe meme, because why not? In summary, the demographic transition is an economic transition, right? You're going from a population of mostly teenagers and children to a population of mostly adults, and because of basic human physiology and because of time, right? Very, very important variable here. You get more labor hours per capita, more output per capita, and through that growth Hoover theory, you also get a faster rate of growth per capita. Let's go back to that village example, right? Let's say you have two villages. In one village, you have 50 workers for every 100 people. In another village, you only have 5 workers for every 100 people. Convergence will not occur, right? In fact, divergence will occur. The only way those villages can enjoy shared growth and prosperity is both of them have the same ratio of 50 workers per 100 people. So effectively, that's the demographic transition, and that's what we're attempting to do here with our project. And that's basically how our model works. Important to note that this is purely for illustration. We're here to inspire you as a scholar, as a thinker, as an academic, as an intellectual. You're more than welcome to use variations thereof, but you'll ultimately come to the same conclusion once you use an endogenous neoclassical model. And like I said, if this has been of use to you, please, we've said in earlier videos, please do consider supporting our work. We've got a Patreon. You can give us a like and a subscribe if you found this useful. And we hope that you will join us as we continue to try and integrate the demographic transition theory into macroeconomic analysis. Thank you, my friends. God bless and goodbye.